It's 2 a.m. You're staring at a lab result in a patient portal. One number bolded in red. And Google is telling you it's either nothing or it's everything. You close the laptop and just lie there. Every single week, more than 300 million people take questions like that to ChatGPT. But it never knew your numbers, your labs, your meds, your history. As of today, it can. OpenAI just launched Health in Chat GPT in the US. You can securely connect your actual medical records and your Apple Health data on the free plan. By the end of this video, you'll have it set up. You'll know the 5 prompts that are actually worth running, and because this is your medical data, you'll know exactly which privacy switches to check before you connect anything. Here's the problem this actually solves: your health story is scattered. Labs in one hospital portal, visit notes in another, your medications in a pharmacy app, your sleep and workouts in your watch. Nobody, including you, can see the whole picture at once. So every time you ask an AI about your health, you're retyping context from memory and it's answering blind. With health connected, ChatGPT can compare a new lab result against your prior tests, summarize what changed since your last appointment, keep track of your medications, and connect your sleep, activity, and workouts to the questions you ask. Open I actually tried a version of this back in January, a separate health section you had to visit. It flopped for one simple reason. Over 70% of people's health questions came up in normal conversations, planning meals, booking a restaurant, so they rebuilt it. Now, your health context can follow you anywhere in ChatGPT with your permission, which we'll talk about, because that phrase is doing a lot of work. What can you actually plug in? 4 things. 1. Apple Health, that needs an iPhone. 2. Medical records from supported US hospital systems. You log into your patient portal through ChatGPT and it syncs your records. 3. One Medical. 4. Function Health. And here's the part most people will miss. If you wear a Whoop, an Aura Ring, a Garmin, or you log food in MyFitnessPal, anything that already shares data with Apple Health flows through too. Who gets it? The US only for now, 18 and up, on web, and the iPhone app, on every plan, including free. It's rolling out gradually. So if you don't see it yet, give it a few days. Setup takes about 5 minutes. Open Chat GPT and look at the left sidebar. There's a new tab called Health. If it's hiding, check the More menu. Hit Get Started. Choose what to connect: Apple Health or your medical records, and follow the sign in steps. Then it syncs. A few minutes normally, longer if you have years of history. While it syncs, you can connect more accounts. Then comes the step everyone will skip, and it's the one that decides whether this is useful or dangerous. Review what synced. Medical records are messy. A medication you stopped 2 years ago may still be listed as current. So ChatGPT walks you through your active conditions, current medications, and family history. Confirm what's right, mark what's outdated, add what's missing. Do it. An AI, reasoning from stale records, gives you confident answers about a body you no longer have. One more trick: if ChatGPT doesn't use your health data when you expect it to, type @health in your message to pull it in explicitly. Now, the good part: what to actually do with it. 5 prompts in order of value. 1. Explain my latest lab results in plain English and compare them to my previous tests. That red number finally gets context. Is it new? Is it a trend? Is it stable? 2. I have an appointment coming up. Based on my records, what should I ask my doctor? You walk in with a list instead of a blank stare. 3. Summarize everything that's changed in my health since last year. This is the one an early tester called out. He had years of overlapping diagnoses, imaging, surgery notes, and it turned them into one clear timeline he could actually understand and hand to his physical therapist. 4. What patterns do you see between my sleep, my activity, and how I've been feeling? That's your watch data, finally earning its keep. And 5, the everyday one. It just quietly makes normal conversations smarter. Ask for a restaurant. It remembers your allergy. Plan a weekend hike. It remembers the knee you injured in March. You don't re explain yourself every time. That's the actual product. An AI that already knows the context you're tired of repeating. Quick pause, because the next section is the most important one in this video, the privacy fine print. If this breakdown is already saving you the hour of digging I did, that's what every video here is. Real talk. 90% of you watching haven't subscribed. On Facebook, subscribe is the supporter button. That is what keeps the lights on here. On YouTube, it's free and it tells the algorithm to send you more. Subscribe to support us. And if these breakdowns are worth real money to you, the join button makes you a member of the lab. Okay? The fine print. This matters. This is your medical data, so let's be precise. Here's what OpenAI promises in writing: your connected records, your Apple Health data, and every conversation that uses them are not used to train their models and not used to target ads, regardless of your training settings. That data gets extra encryption on top of the standard. By default, ChatGPT asks before it touches your health data every single time, and you can leave it that way. And if you disconnect an account, the synced data is deleted from OpenAI's systems within 30 days. Now, the fine print they say quietly. 1. Conversations already in your chat history. Keep the health details in them until you delete those chats. Disconnecting doesn't scrub your history. 2. Your normal conversations, the ones that don't use health data, still follow your regular training settings. Go check settings, data controls today. 3. This is not a HIPAA product. No business associate agreement. It's a consumer feature, and your data sits under OpenAI's health privacy notice, not your hospital's. 4. It's read only. It cannot write into your records or Apple Health, which honestly is the right call. My take: connect it if the value is real for you. Leave the ask every time permission on and use a temporary chat for anything you wouldn't want sitting in your history. Is the medicine any good though? Here's what's underneath. The free plan runs GPT 5.5 Instant, which OpenAI says performs near their frontier reasoning models on hard health evaluations, trained specifically to spot when something needs urgent care, ask for missing context, and admit uncertainty. Paid plans get GPT 5.6 Sol, their strongest health model yet. And the grading isn't vibes. They built the evaluations with hundreds of physicians, and physicians tested this feature before launch. But hold on to their own words. It can still make mistakes, and it does not replace your doctor. Use it to understand, to prepare, to ask better questions, not to diagnose. Before you run off, the gotchas, rapid fire. Apple Health needs an iPhone. Android users can still connect medical records on the web. It does not work in voice mode yet. If you used the January health experience, your old chats did not move. They live in a health project under projects in your sidebar. If your hospital isn't supported, you can request it through OpenAI's Help Center. Some app scores, like your Aura sleep score, may not transfer because apps don't share everything with Apple Health. And if you're managing a parent's health, don't mix their records into your account. Use a separate account or a separate project with project only memory. Family history, though? That one's worth adding to yours. So, should you connect your medical records to ChatGPT? 3 honest postures. Screenshot this. Posture 1. Full connect. You're actively managing something, a condition, a recovery, real lab work, and the timeline view is genuinely valuable. Connect it all. Keep Ask Every Time on. Posture 2. Fitness only. You're healthy and curious. Connect just Apple Health. Keep the medical records out, and you still get the sleep and training insights. Posture 3. Not yet. You're not comfortable. Completely fine. You can still ask every health question you want without connecting anything. You just paste in the context you choose when you choose. There is no wrong posture. There's only knowing which one you picked and why. Here's the transformation. Plain. Last week, your health lived in 5 logins, a folder of PDFs, and your memory of what the doctor said. Tonight, you can walk into your next appointment with a 1-page summary of what changed and the exact questions worth asking. That's not AI replacing your doctor. That's you, finally briefed on your own body. I've packed all of it into one free PDF, the ChatGPT Health Setup and Privacy Kit. The 5-minute setup, the 5 prompts, word for word, the full privacy checklist, every switch and where it lives, and the decision card. Comment the word health and I'll send it to you, free. Or grab it directly at hyperautomationlabs.co/free/health. Just getting started with AI tools? My step-by-step beginner guides are linked in the description. I post quick AI moves every day on Instagram and Facebook, and the full deep dives live here on YouTube. And here's round 2. I want to connect a real month of Apple Health data and put those 5 prompts through their paces on camera. If you want that test, type labs in the comments. Health. Go.